morning, and it's a warm welcome to this IAPS International Seminar 2021. It's on the topic pandemic and population dynamics. It's my great pleasure to welcome you all on behalf of the organizing committee, Professor Seydhu Nisa, Professor Nagarajan, Professor Doctors Manoj, Dr. Reshmi, and Dr. Preeti, on behalf of all the organizing committee members, also as on behalf of IAPS, welcome to you all for the IAPS International Seminar, which is on a very important topic this year. I know every year IAPS holds this seminar, I think primarily with perhaps a twin objective, we can say. One is definitely, undoubtedly, the importance of population and demographic research has to be brought to the limelight in terms of research, policies, and programs. That is the, you can say, the core purpose of IAPS seminar every year. And we have been doing it in different parts of the country so that the regional perspective will be emphasized and the importance of the interstate variations and regional variations in demographic patterns, demographic trends, and the causal linkages between demographic factors and other determinants are emphasized. But this year, as all of you know, we have a very peculiar situation. We are in a pandemic situation, so naturally, this virtual conference here or virtual seminar this year, where we really don't have an emphasis on the regional perspective, but at the same time, we want to emphasize or concentrate on the issues currently the world is facing, that is on the pandemic. As all of you are aware, we have suddenly, perhaps 1 year back, the country or the world has taken a bite really because sudden arrival of this pandemic, COVID-19. And as a demographers, we always look for what would be its impact. Actually, that was a major effect. Initially, it was actually all emphasis was on the estimation and actually modeling part and prediction part. How can effectively predict the future trajectory of this pandemic? There has been several works on that. We also have a special session this time, this seminar on really looking at the trajectory of the future trends. But in addition, actually, one of the major emphasis was on what would be the impact at the fertility level or the birth rate, or what would be its impact at the mortality level or the morbidity level and the hospitalization, utilization of the hospital care facilities, and what would be perhaps its impact on the migration level, which are the three key demographic determinants. The initial trends of predictions on the fertility level has given perhaps a gloom trend on what would be the COVID-19 impact on the utilization of the healthcare facilities and the fertility and abortion trends, etc. Particularly if you look at the UNFPA projection, which has really happened during that period, which has really predicted that around, I think, 47 million women in 114 low-income and middle-income countries, including India, will not be able to use contraception. That was actually, they have suspected, which will have, and something around 7 million unintended pregnancies, which will have also impact on the abortion, which will have impact on various other aspects of the fertility or the utilization of the healthcare facilities. And even at the mortality level, actually, the initial prediction has been very, very pessimistic because the fatality rate was slightly higher at that time. Perhaps over a period of time, we know much more about this pandemic, much more about this virus. And so we know perhaps the fatality impact is not as high as what we would have expected in the past, but at the same time, we need to know more about it. Maybe usually pandemics are really not that much talked about in the case of migration, but the COVID-19 perhaps had the largest debates and discussion on the issue of migration, particularly because of the lockdown and its impact on the various aspects of migrants and migration, as well as various other aspects. I think this is something which different countries are now seriously discussing and debating and trying to estimate and trying to look at the causality and everything. But India, the works has been relatively limited. Although IAPS initially had a working paper series on the COVID-19, which had almost 20 to 25 papers has been published and widely circulated as well as widely debated in the news media, etc. But at the same time, I think there are we need to know much more about this pandemic. We need to know much more about what is really the impact at various aspects, whether it is the society, whether it's at the community, whether it's a household, and whether it's at the individual level. So the purpose of today's or the 2 days or 3 days of a national seminar, international seminar, is to really bring together scholars and students working in this area and to examine how actually it will have impact at the various aspects of the society, and then look at the research issues as well as to bring out the program and policy implications. And thereby, as I told you, we have also one of the major objectives of this IAPS seminar always been that we encourage young researchers and to gain them much more insights on how do we really make presentation, how do you really enter into the debate and discussions in the research field, and also make their research useful for the programs and policies. So with this twin objective, I'm sure this year's IIPS seminar also will be very successful. By looking at the program itself, one can understand that actually it has been a wonderful set of scholars who has been agreed to speak in this seminar. So I look forward to a stimulating discussion and also a wonderful 3 days of the academic feast, which will help the country as well as the people at large. So thank you all once again for joining. I look forward to the next 3 days of the deliberation. So it's my great pleasure at this time to welcome Ms. Sandhya Krishnamurthy, who would be inaugurating this seminar. As you know, Sandhya has joined as the Director General of Statistics, the Ministry of Health and Family Welfare. And thank you, Sandhya, for agreeing to be inaugurating this seminar, and we look forward to listening from you. Thank you for agreeing, because we know that you have joined only a couple of weeks back in the ministry, and suddenly you have to be given this responsibility. Sorry about this short notice, because you have joined late only recently, but at the same time, we look forward to your cooperation. I know that you have been working in such areas, because at the NSSO and the CSO, you have been actively involved in looking at the data sets and also at the employment and all other data sets, which is very close to the demographic research. So we look forward to your inaugural talk, as well as thank you for agreeing, and welcome once again to this inaugural session. So with these words, I will stop, and thank you once again for all the participants for joining. So for this second, let me now request Professor Sredenisa to speak something about the seminar, what is actually the focus of this year's seminar. So Sredenisa is one of the organizers of this year's, coordinators of this year's IIPS International Seminar. Over to you, Professor Sredenisa.
Thank you, Professor James. Madam Sandhya Krishnamurthy, Professor James, Professor Nagarajan, Dr. Manoj Alakrajan, Dr. Preeti, Rashmi, other friends and colleagues. Most of you are aware that each year we have annual seminar. We organize it, as Professor James said, in different states. And the purpose of organizing the seminars is, one of the objectives of IIPS is that dissemination of knowledge, training of young people, as well as involving different researchers from different states to learn about population issues and their own research. So that's why each year this is a constant phenomenon. But this year things have been so difficult. And what we thought, instead of going to any state issues, it will be better if we go global issues, go for global issues. And the most one, this pandemic had made so much difference in the lives of the people all around the world. It's not only in India, it is all over the world. And people have to act or to cope up with these problems in different ways. And the governments have to change their policies, programs to cope up with the pandemic issues. And as it has been said, all the components of population got affected because of this pandemic. So with this in mind, in IIPS this year decided that we will work on pandemic and population dynamics. And in population dynamics, as it has been said, in the previous pandemics, what used to be happen, only mortality used to be affected, mortality used to be high. But whereas now it has some impact on fertility as well as migration has been seen during lockdown. It is influenced very much. People have suffered because of in-migration, out-migration, international migration. So these components are very much important and we need to discuss in a global platform. That's why we have said that this year seminar will be international seminar, not the regular annual IIPS seminar. And we have many plenary speakers who are working in different universities, in different countries, researchers, NGO persons, they are involved in plenary sessions. Apart from that, for our call of papers, many young researchers and the people who are working in the field of health and population issues have responded it to positively. And we are very happy that we are able to organize this virtual conference. Maybe it could have not been possible with such a short period of time to call the people and have the meeting, but because of availability of technology and all those things, it is possible now to have virtual conferences, seminars. So one of the booms also, you can say that this is helping us to learn from different countries at one place. And we have in this seminar 6 plenary sessions. 4 are directly related to pandemic issues, and one is on the estimation, projection. These are from different people working in US and other places, and Google person is also involved in this thing. Indian researchers are also involved. The other one is about public health in the era of pandemic. The third one is about how to get estimates of census that we are going to discuss in panel discussion. The fourth one is about the psychological and economic impact of pandemic on gender. These are the 4 plenary this thing. Apart from that, we also have 2 plenary sessions from our large scale surveys, namely NFHS and LASI, that is All India Level Survey. And coordinators of these projects are going to discuss major findings of this project. In our technical sessions, we have 18 technical sessions for this conference. Out of that, 12 are directly related to the estimation, projection, data quality, utilization of health services during pandemic, gender issues, morbidity and mortality, and impact of COVID-19 on the lives of people. And many people have written on that. We have made 2 sessions for that impact of COVID-19 on the lives of people. And also we have 1 session, technical session on gender issues during pandemic. Apart from that, some of the researchers have given abstract on different issues of health and population that also included in our seminar. Those are 5 sessions. And one is a session we have kept from CNSM data, that is also all India level data. We are talking about slum, non-slum and nutritional level of children and adolescents. We have kept each session of 90 minutes duration, and mostly 5 to 6, mostly 4 in plenary session we have kept 4 speakers. In technical sessions, around 5 speakers are there. In 1 or 2, only 6 speakers are there. Otherwise, we have kept this small number so we can have a lot of discussion in this thing. And the complete program and abstract book are available on the website. And you can see that. Please show the program. Yeah, a complete program is on the website. And we have also circulated to all the participants, plenary speakers, chairpersons, this program. And you have to just click whichever session you want to go in this thing. You have to just click and that will open. In that, you have to give your name, email ID. It will not ask you any password or anything. Just you have to give email ID and your name and you can log in. And this is event, this thing. WebEx event. So here only plenary speakers will be visible. Other participants, attendees, they can write their question in the chat box. And if time permits, we will also allow audio and video questions in these sessions. So feel free to participate and ask the questions. And I'm sure with all of you participating in this seminar from international organizations and different countries, this will be very useful for planners and management purposes. And many government people will also use our findings, research, this thing, output, whatever we are going to discuss in this thing. I am sure that this will be a useful seminar that can be used for planning and policy. And with this, I say that all the best to all the participants for their presentation. And I thank all the people who have submitted papers and readily accepted our invitation for chairing, discussion, and plenary sessions. Thank you, everyone. Thank you.
Thank you. Thank you, Professor Denisa, giving an overview of the 3-day international seminar and about the plenary as well as the technical sessions of the seminar. And may I now invite Srimati Sandhya Krishnamurthy, Director General, Ministry of Health and Public Health, to give her inaugural address. Over to you, Sandhya.
Very good morning to all of you. It gives me a pleasure to be here for the inaugural session. And as Professor said that I just joined a few days back, and I'll get to gear up to look into the functioning of my areas that I have to really look into that. Anyway, it was a very good time to look into all these issues. I'm very glad to be here. And what I see in the forum is all full of research scholars and who have got a very vast experience in the field of demography. So I need not, my experience is very little. So I get to learn, I'm a learner to this forum. But as you all understand, and this is my understanding, that IIT is a very renowned institutions worldwide for its devotion in the field of training and the area of population related studies. It has done a pioneering study in these areas, and they really should be proud for that. And for this year, they actually, it is one of their mandates to organize these international seminars in the areas of population research and the studies they have undertaken in collaboration with other stakeholders, universities, and NGOs and governments. And they have been taking, and under the leadership of Professor, who I think probably he has joined also recently, I don't know. But I think he will be taking under the leadership, and definitely he will be taking the institution to the height. As far as you all know that it is IITS, which is under the administrative control of Ministry of Health and Family Welfare. And this year, I think the budget estimate we have given is around 60 crores. And everybody knows that the pandemic has really brought impediments to the institutions for not taking up the work which eventually they had to surrender. That is well understood. And I'm sure that the years to come, definitely will be taken up. Coming to this seminar, the topic has been that I understand the pandemic and the population dynamics. The subject of the seminar topic is very, very interesting, at least for me, because the pandemic, as everybody knows that the pandemic has an impact on the global economy, and we have to accept it. It's never given a choice for us, but we have to accept and adapt to it. Given that Professor has rightly pointed out that the areas like the fertility rates, these are the population dynamics, and especially if there is some morbidity or mortality, and the other issues like the healthcare system really had impact, which nobody had prepared for that. They were not equipped fully across the globe, even the developed economy and even the underdeveloped, not forget to say it, but they were not, the preparedness was not there. And because everybody had to struggle with that. So, and the other issue when you look at it, it's the migration, definitely the migration, because they have taught the in and out migrations and how, especially the workers, they have really struggled and we have handled it. But still, this is all a learning for us. Pandemic has really definitely made us to learn. This is a learning. We have learned so many changes and brought it to us. We at individual level, society, and across, it has brought changes, and that is very appreciated. Maybe on the positive side, we have to do. There are all challenges that we have to look into that. And for IIPS, being focused on the areas of research on reproductive, child health, and aging. These are some of the areas, core areas that we have looked at. This is that from the pandemic angle, we have to, I think already, as we have rightly pointed out, that already some 20 to 25 studies have been already on the pandemic issues that being brought up. That is really, we are looking at it. This is a very interesting that one. These are the challenges that, like that, how we have to address it. So we have to accept in an embracing way rather than, not accepting that, okay, we have to accept it and see how that, rather than resisting, we have to resilience and we have to see the well-being of that. So this pandemic has really brought, and what I've seen, the topic, the sessions that I think Professor must have taken a lot of, he has put his thoughts in that, what are the subjects of that has to be chosen for this seminar. The way that it has been for another 3 days is going to be a real interest. Something that probably which has not taken place earlier that they have brought, and it's going to be a very interesting, and everybody will be definitely looking into these issues and how these issues are to be addressed for the planners, policy makers, everything. So the challenges and especially in these areas. So I'm sure that this 3 days seminar is going to be of immense use for everybody and see how these issues are to be addressed. So, and we have to accept it, and definitely this pandemic with this has given a way how to meet, take it and accept these challenges. This few words, I thank Professor for giving me this opportunity and to be a participant in these forums, because some of the areas, from my area also, like on the domestic violence, that's going to be a very, some of the subject specialists have taken on domestic violence also on this of my areas of research, and I am looking forward to listen to participate in these sessions. Once again, I thank and appreciate Professor James for taking the lead, and sure this is going to be a successful seminar, international seminar, as well as for the research and the youngsters. We have to make them really involved in that and how they are going to address these issues and bring out. Right? That is very important. It is one that we have to motivate them also. And I'm sure that that with the university level, probably I don't want yet to understand. I don't know whether these are being practiced at the university level. Some awareness programs also should be introduced wherever the departments of that I think some regular seminars or awareness programs should be attended. So as to students concentrate in the areas of this, I sure success. Thank you.
Thank you, Ms. Sandhya Krishnamurthy. I think you have rightly pointed out the important issues which confronts the pandemics like this, particularly the issues of aging, which you have emphasized, particularly on the issues of migration, you have really emphasized. And also the other issues like domestic violence, which we, I think, forgot to mention. I think that is so important, which you mentioned that it is also at the heart of your areas of interest. So, which is also very, very vital for an issues like pandemic. Usually, we don't discuss these issues in line with pandemic, but all these are coming brought by primarily by the media to the forefront. But the research on these issues are still very, very limited. We need to really dwell much more into these aspects and then see what would be its likely impact at the household and family level. I'm sure many of these papers in this forthcoming technical sessions will discuss these issues, and we will have an interesting discussion and debates as well as on the policies and programs which can really be addressed to address such kind of a menace. So thank you so much for giving a wonderful ideas on this seminar, and thank you for inaugurating the seminar. So we look forward to working with you in the coming years, and I'm sure your support and collaboration are not only about IAPS, but the demographic research and population studies as such in India. We need to really rejuvenate it at various levels as well as in various institutions. I'm sure we would be successful in coming years. Thank you so much once again. Okay, let's come back to the end of the inaugural session. So before we are closing, let me call upon Professor R. Nagarajan and the coordinator of this seminar to give an vote of thanks. So over to you, Professor Nagarajan.
Good morning, all of you. I think there are nearly 150 participants are there. It is really a very successful the event that even when we organize a physical conference, this much participation may not be there, but it's a large number of participants. Thank you all for attending this. So I'm here to give a brief vote of thanks. At the outset, I would like to thank Mrs. Sandhya Krishnamurthy for accepting our invitation in a short notice and also delivering the inaugural address for this conference. Thank you very much, Madam, for delivering your inaugural speech, and hope IIPS will get all your support, for our regular activities. Thank you so much for that. And I must thank the Ministry of Health and Family Welfare, particularly, for providing annual grant to have this conference regularly. So without the financial support, generous financial support from the ministry, this is not possible for us to organize the conference. So thank you so much for the ministry. And I must thank Professor James, our director, for giving constant support and guidance to conduct this program. We had several rounds of meetings almost regularly, starting from planning for this conference and planning for the plenary sessions and technical sessions, and identifying the scholars to give, to chair the plenary sessions and give plenary talks. So a lot of meetings went off, and his support made us to, organize this conference, this virtual conference this year. And normally conferences have various activities. In a normal conferences, you have a lot of logistics to be arranged, starting from transport, catering, stage arrangement, and so many activities. But this year, due to pandemic, it is not possible. So, and we discussed with our ICT team, and they gave a confidence that we can go ahead with the virtual conference. So our ICT team, headed by Mr. Anjani Mishra, gave a confidence for us to go ahead. And I thank Mr. Anjani Mishra and all his team for giving a good support to go for this virtual conference. And we took a lot of help from our student volunteers. They were working behind the scene to organize this conference. There are many student volunteers, particularly Mr. Rajendram, Ms. Labita, Mr. Chanda Maurya, and Mr. Shreyans. All of them helped us in so many ways to arrange this conference. I thank all of them. And also, I have to, this organizing committee headed by Professor Syed Unisa, helped us to, arranging this conference successfully, and several rounds of meetings. Almost every day we had the meetings on various aspects, after getting the papers, shortlisting the papers and putting the papers in different sessions. So everything, and we had as a team, we all worked. So I thank Professor Syed Unisa for giving the leadership for the conference. And my colleagues in the organizing committee, Dr. Manoj Jalagarajan, Dr. Manas Pradhan, Dr. Reshmi Nair, and Preeti Dhillon, all of us, helped us in every activity. So I thank all of them. And I must particularly thank Dr. Manas Pradhan, who is not here with us today, unfortunately, as a coincidence. When we are organizing this conference on pandemic and population dynamics, he himself was tested positive last week. So that's why he is not here. He is recovering and he is fine. So I thank him particularly for his all-round help in every aspect of this conference. And yes, and I also thank all the staff in IAPS, all the administrative staff for us to give all the support to organize this conference. And at the end, I must thank all the, the chairpersons who are invited for this conference and the plenary speakers and all the participants who are going to present the articles for the next 3 days. I thank all of them and thank you very much. So we are going to have a good, we have put up a good scientific program for next 3 days. Hope all of you will be enjoying that. And thank you one and all. Thank you so much. Yeah.
Thank you. Thank you, Professor Nagarajan. That is the close of the inaugural session.